Welcome back. If you want to explore your options when it comes to managing your health, listen up. Many people get an ache or a pain, then go to the doctor.
Well, joining us once again is Dr. Khanna, is the medical director at the Pain Medicine Physicians, and Kathy Wright is a certified nurse practitioner. The last time you guys were on the show, you were talking a little bit about pain management, and you mentioned that you are practicing age management as well. First of all, it's so good to see you guys again.
Thank you. Nice to see you again, too.
So, Dr. Khanna, let's start with you. How did you become interested in age management medicine?
Well, I've been doing this for the last 20 years, and I am not 40.
And you're like me, you're celebrating your annual 29th. We're just not going to tell anybody which one.
Exactly. I realized that what I'm doing is just putting a Band-Aid on the problem. And this being the 21st century, there are a lot of new treatment floating around that are actually curative or will repair new tissue, new cartilage. For example, platelet-rich plasma in the knee, injected in the knee, will grow new tissue. Stem cells will grow new bone, new cartilage. So you cure the problem, and that's I want to be part of the preventative medicine rather than just repeat business.
Yeah, exactly. That's that. I like hearing that. And Kathy, last time you talked about genetic testing and how you guys use that. Tell me about that.
We've been getting really excited about using that again, working towards preventative medicine. Our bodies, each body has a genetic blueprint, and the blueprint is your genome. They unraveled the genome in 2003, and what that is a complete set of chromosomes, your complete set. So it's individual to you, and everyone else out there. So science has found a way to look at how those specific genes change our metabolic pathways individual to the person. So we use that information and set up a customized wellness plan.
Yeah, I was going to say, then how do you do that? How do you use that information to then customize to this plan for each person that comes in?
Right. We swab the cheek, send that information of the cells to the lab. They send us back an analysis of what pathways are affected and how then diet is individual per person, how our body manages diet, stress, medications, and develop a plan based on that specific customized information.
What are the specific aspects of age management that are appealing to your patients?
Well, I think helping them bring back their sexual function is perhaps the most rewarding for them. Especially in women who do not like to talk about that. So treating the hormone imbalance by hormone and optimizing the sexual desire or libido and improving their self-image.
Saving marriages.
Yes, and improving relationship. Because most of the divorces happen in 40s or 50s. Men find somebody else, but women, poor thing, there's nobody helping them. So that's what I want to focus on.
So does all of this then testing then fit into the age demographics then and the age management then in the individual style that you are treating each patient then?
Exactly, because we send off hormone levels. We don't treat something just willy-nilly. We send off labs, we get those labs back and see what it tells us about that individual and how we can optimize that and make their life more
enjoyable.
Interesting.
The genetic test, you said the way you do it is just a simple swab?
Simple swab, painless swab to the cheek. We send it to the lab, we get the results back in 3 weeks, we review it with the patient and devise a plan.
And are the results based off of analytics that the system knows, based off of these genomes, based off of this type of
genotyping?
Genotype, this is what we see would help you?
Yeah, and things like it will even tell you if what kind of diet is good for you. Should you use low fat or regular diet or Mediterranean?
Not to interrupt you, but some diets won't work for some types of people, so you could just be literally beating your head into the wall and not really getting anywhere.
You can analyze your genes and figure out.
Interesting.
Also, if you have a snacking habit, it'll also tell you that.
Really? It'll say, you eat too much chocolate. I would hate to see the Cliff's Notes for my test.
And it will also identify health risks, genetic health risks. So if they're identified, you can better work on them and say, given that genetic bullet, how can I best dodge it?
Can I ask, like what? Like what would you get? What would be an example of a health risk that
Heart problems, elevated blood pressure problems that you treat, risk of stroke,
which
risk of
medications
obesity.
would work if you have high cholesterol, which will not work, and how much is the risk based on not on the family history, but just in
on your
genotype.
own genetics?
Yes.
Wow,
Lots
thank
of
you guys for
information
being
in that
here. We
little
appreciate.
swab.
Yes.
Yeah.
Very cool. Thank you.
It doesn't cost too much. I think everybody should get it done. It's once in a lifetime test.
Get
There
it
you
checked
go.
out.
There you go.
Appreciate
Good
it.
to see you, ladies. Thanks again
Same
for
here.
joining
Thank
us.
you.
Thank you.
We'd like to thank the Pain Medicine physicians for making this segment possible. For more information, visit pmpjax.com or call 904-495-7200.